Good afternoon, my fellow Americans. This is Dr. Rick Redalen, the Maverick Doctor. Let's talk a little bit more today about medicine in the United States again. Try to get this word out to your friends. I know it's hard for young people to get interested in healthcare because when I was young, health was the last thing ever on my mind. It only affects the few of us that do not have good health while we're young. What I'd like you to think about is that in the United States today, the main cause of death with health issues is heart disease. Behind that is cancer, and the sad truth of the matter is that the third leading cause of death in the United States is healthcare itself. Isn't it a sad fact to think that we can get sick and that we're going to enter an institution that is the third leading cause of death among us in the United States? Many of our deaths are drug errors. Some are errors of omission. Some are errors of commission. Sometimes we omit something that needs to be done for us. Other times we're having things done to us that don't need to be done to kill us. I was in Israel a year and a half, 2 years ago. I don't know, time slips away. And I was at a pharmacy there to just ask them about drugs and drug errors and how they avoided them. And what was pretty amazing is that they had a computer that went up and down the shelves of drugs and picked out each drug, labeled each drug, packaged all the drugs together, came out with all the instructions. I asked them how many drug errors they'd had in the last several years, and they looked at me really pretty perplexed, and they said, well, why would we have a drug error? Our computers do this. They said, we don't have drug errors. And I said, well, how many deaths have you had from drug or medication problem in the past 2 years? And they said they have not had one. You cannot go to a hospital in the United States that can make that claim. You can go to a hospital when you receive medications. Ask your nurse each time she gives you a medication, what is that medication? If the medication looks different from the last one you got, ask her why is it a medication different in color. For instance, I'm on one medication that comes yellow, it comes a light tan, it comes a darker tan, and they're all different sizes, but they're supposedly the same medication. That particular medication is lisinopril. It's an ACE inhibitor. It's a very commonly used medication in the United States for a number of different things, from hypertension to congestive failure to what have you. But every time you get a medication that's different from last time you got them, ask the pharmacy, the physician, the nurse, what is this medication? Why am I taking it? And please keep these things in mind every time you get a change in your healthcare in the hospital. And always remember, when you go in the hospital, your aim should be to get out of there as fast as you can. And always remember that our healthcare system is the third leading cause of death in the United States of America. Yes, this country where we keep saying we're number one, we got to just keep saying it more and more, so one of these days we're going to actually believe it. This is one of the most wonderful countries in the world, and I've traveled all over the world. We have to be proud of it, but there have to be people that will be outspoken, such as myself, that want to keep it this way or make it better. Let's make America great again. God bless you and have a blessed day. Again, this is Rick R. Redalen, a medical doctor and the Maverick Doctor.